And now let's just quickly review diagnosis. What are the common symptoms of AF? I would encourage you to go back and look at those four cases that we discussed because I think we really did try to illustrate the most common symptoms. But here, just familiarize yourself. I mean, overall palpitations, 33% of individuals reported palpitations. But guess what? That means 67% of individuals didn't feel palpitations, which is why the presentation of AF can be not exactly straightforward. So you have to really, again, have that level of suspicion when individuals come in your practice with various symptomatology. Diagnosing AF, again, you can read through this. We've gone over this with our cases, but absolutely everyone who comes in my office, I'm listening when the MA, a medical assistant, takes the blood pressure, boom, 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 boom. I can hear it. I'm already sitting there at my computer, but I'm listening to the heartbeat. That's also going to make me be very careful if I hear anything that's irregular in there to the actual cardiac exam. And before that patient leaves my office, they will definitely have a 12 lead electrocardiogram and they will have a discussion no matter how late I am today. I'm going to sit down and I'm going to talk to you about an anticoagulant if the guidelines recommend that you indeed should be on an anticoagulant. Let's not forget that the paroxysmal AF is a bit trickier to diagnose because you got to capture the rhythm when the patient is feeling the symptoms. But there are many ways to try to do that today. When you look at how many people are asymptomatic or undiagnosed, and I think here you can really appreciate with claims data that undiagnosed patients tend to be older, you just don't feel the same symptoms, and have higher risk scores than diagnosed patients. So, just like our 82-year-old case, Miss Holmes, she didn't appreciate that she was in atrial fibrillation all of the time. Her only concern was fatigue. So, early recognition, I think, is important, certainly with individuals with no symptoms from their atrial fibrillation. And as we've already discussed, high level of suspicion. What's scary, I think, for me as a physician is that because there aren't symptoms and the patient doesn't know, 10% of individuals will present with an ischemic stroke. And that's the first diagnosis with AFib that they have. I mean, that is like, how do you prevent that? But that's a challenge. So that remember that atrial fibrillation, it does seem to progress. We can arrest to some degree that progression by aggressive risk factor modification, like we've discussed. So the key takeaways, the common symptoms are still pretty nonspecific, with only 33% of patients reporting palpitations. Many patients with AFib are asymptomatic or undiagnosed. And a 12 lead electrocardiogram is the recommended test to make a diagnosis of AF in the office if you appreciate that irregular heartbeat and irregular pulse.